What are the types of androgenic alopecia for whom hair transplant could be the first line of treatment, while others you should not jump into hair transplant?
Correct. So androgenic alopecia can be broadly classified into two types, which is a pattern type and the non-pattern type. In the pattern type is what we commonly come across with classified as Norwood classification from grade 1 to grade 7, wherein there is temporal angle recession and then gradually it increases, and then there is a loss of hair in the vertex region, and both these areas will coalesce and finally you will lose the entire hair along your frontoparietal area. Compared to that, there is also another type called as the diffuse pattern alopecia. Now diffuse pattern can also be in two types, which is diffuse pattern alopecia and the diffuse unpatterned alopecia. The simple difference between them is, as the name unpatterned suggests, all the hair, whether it is in the frontoparietal area, whether it is in the back of your head or in the sides of the hair, all of these hairs are getting affected and start becoming thinner. So these patients who have thinning all across the scalp are definitely not the candidates, and we should not jump into hair transplant for these patients. Whereas for diffuse pattern alopecia, where the thinning is happening across the frontal and the parietal area, but they probably will never get bald, only the hair will start thinning and become miniaturized but never gradually completely disappear, can be considered as candidates for hair transplant along with the normal pattern of androgenic alopecia based on the Norwood classification.
Okay, so now we've known the types of androgenic alopecia. Let's come to the treatment. So we understood if you have a diffuse unpatterned androgenic alopecia, first you have to make sure that you reduce DHT influence on all the follicles, so the medical management becomes the mainstay. Once the medical management blocks the effect of DHT, you can have hair injectables. If you have not seen the video, please look at the video where we've spoken about PRP, GFC, exosome, SVF, whatever it is. Use any of them to induce more hair growth once you block the effect. Now let's talk purely about patients with pattern baldness, and let's talk about hair transplant. One important thing I would like to ask Dr. Anish, which you would like to expect an answer from any of us, is hair transplant procedure permanent?
Yes, hair transplant is permanent, but you also have to understand two important things. One, if you have your native hair that is present in the frontal and the parietal area, you may continue to lose those hair. So even if the transplant has been successful and if you continue losing your actual native hair, you may end up having thinning and again go back in the further grades of alopecia. The second thing is, as ma'am pointed out, the epigenetic changes. Although we have not enough studies on it, there is a chance that the transplanted hair, once they have shifted back from the sides or the back of the hair, and where they are kind of resistant to the effect of DHT, once they are shifted into the frontal and the parietal area, can become sensitive to DHT, and there may be miniaturization or thinning or loss of hair even after transplant. So it's very, very important, as Dr. Jayanthy pointed out, that medical protocol or the medicines need to be taken along with the hair transplant.
I would like to reiterate this again. Hair transplant, like what you think, it is permanent for a short time. It's not permanent for your life, right? Once you relocate, they are not so sensitive to the DHT immediately, but they may probably undergo epigenetic changes, or there is no aromatase as high as what is actually published in the occipital scalp, and so DHT can start action. So nowadays, with boys coming or young men coming for hair transplant at a very young age, probably between 20 and 25, and if you want to preserve this hair, when you say permanent, you are expecting it to be present until 60 or 70 years. So that's a long period of time, and it may not be that permanent that long. If you want it to be permanent, you probably have to maintain. And for those who come at around 30-35 years, you've already lost what could be lost. The others are in the preserved zone, and after you transplant, it's important that you proactively make sure that any of this doesn't happen, and which can actually help you to have that transplanted hair in the same caliber, same density throughout your life. So this is what you need to understand. Next important thing when it comes to hair transplant, I would like to ask Anish, you have hundreds of places which is offering hair transplant treatment for you, right? So you are not sure which is the place where you should get your hair transplant done. What are the must parameters that you should choose when a hair transplant should be done? I will say must parameters. Without any bias here, what is important in any procedure, right? Any procedure, aesthetic procedure, none of them are sick. They are not need-based procedures because there is a cancer or there is an injury or a defect. It is a want-based procedure. So what is number one is safety, right? Let's not talk about anything else. What is important in terms of safety when a hair transplant is done? So where could there be risk in a hair transplant? For the patient's life. In Chennai, we have witnessed a death after hair transplant, which is widely spoken about everybody, which had actually scared people from a very simple procedure and a very procedure which is very satisfying from patients. In which steps of hair transplant could there be life-threatening complication?